topic we are going to discuss is the diffuse cutaneous systemic sclerosis versus the limited cutaneous systemic sclerosis. To begin with questions, the first question is in terms of the Raynaud's phenomenon, comment on these diseases, and second one is comment on the antibodies in both the cases. So in this video we'll find these answers to these questions and learn in detail about this topic. So first, to start off with, we are looking at the skin involvement. So what is the skin involvement? So the skin involvement, first we are looking at the diffuse cutaneous systemic sclerosis. That is, first we'll be looking at the diffuse cutaneous, later on followed by points of the limited cutaneous. So first, as we look at the diffuse cutaneous, so diffuse cutaneous is nothing but there is a rapid progression. There is a rapid progression in case of the diffuse cutaneous. There is a rapid progression, and there is also involvement of the skin areas. So the skin areas, if you see, it is involved. The skin areas are involved, and it is proximal. The skin areas, the involvement of the skin areas, it is proximal to the knee or elbows. So it's proximal to the knee or elbows, or over the anterior chest, trunk or abdomen, or the anterior chest, trunk or the abdomen. Then when we look at the LC, that is a limited cutaneous systemic sclerosis, so this is a slow progression and this is totally limited. It is limited. So what is it limited to? It is limited to the face. It is limited to the face as well as the skin. It is distal to the skin, distal. Skin which is distal to the elbows, distal to the elbow and the knees. Now let's just recap. So we saw the skin involvement in this case, and we saw the DC, that is a diffuse cutaneous, as well as the LC, that is a limited cutaneous. So in terms of the DC, it is the diffuse cutaneous, there is rapid progression. There is skin areas which are involved, that is proximal to the knee, elbow and the AT, that is the anterior chest, trunk as well as the abdomen. And looking at LC, that is a limited cutaneous, it is slow progressing. It is limited to the face, a skin distal to the elbow and as well as the knee. Next, we are also looking at the Raynaud's phenomenon. The Raynaud's phenomenon. So Raynaud's phenomenon, it is if you see in case of the DCSS, in terms of DCSS, it is less severe. It is less severe, and there is also a short history. There is a short history. Then when we look at the limited cutaneous, LCSS, limited cutaneous systemic sclerosis, this is most severe. It is more severe, and it is commonly associated with the critical limb ischemia. So it is associated with the critical limb ischemia, and other feature is that it has a long history. Then we are looking at the musculoskeletal system. So in terms of the musculoskeletal system, the DCSS, there is a severe arthralgia. There is also the carpal tunnel syndrome and the tendon friction rubs. So in terms of the LCSS, that is a limited cutaneous systemic sclerosis, there is mild arthralgia. there is mild arthralgia. So let's recap this. So we saw nothing but the Raynaud's phenomenon. So the Raynaud's phenomenon is nothing but the DCSS. DCSS stands for the diffuse cutaneous systemic sclerosis. Diffuse cutaneous systemic sclerosis. So it is nothing but it is less severe and it has a very short history. Then when we look at the LCSS, LCSS stands for the limited cutaneous systemic sclerosis. So the LCSS, it is nothing but more severe and they have a critical, it is a more severe and commonly associated with the critical limb ischemia, and they have a long history. L for long history. Now when we see the MCSS, MCS is nothing but the musculocutaneous system. So in terms of the musculocutaneous system, the musculoskeletal system, there is in case of the DCSS, that is a diffuse cutaneous systemic sclerosis, there is a severe arthralgia. There is also CTS, carpal tunnel syndrome. There's tendon friction, rubs, and in terms of LCSS, there is mild arthralgia, whereas in case of the DCSS, there was severe. Now, moving ahead, we'll be looking at the pulmonary manifestation. In terms of the pulmonary manifestation, we first look at the diffuse cutaneous systemic sclerosis. So there, it is the interstitial lung disease, ILD, which is more common. And in terms of the LCSS, that is the limited cutaneous systemic sclerosis. So what does it include? So the LCSS, it includes the PAH, that is a pulmonary artery hypertension. The pulmonary artery hypertension, this is MC, that is most common. Next we will look at the scleroderma. So scleroderma renal crisis. So the scleroderma renal crisis, and this occurs usually less than 4 years. It occurs less than 4 years of the disease onset. So it is less than 4 years of the disease onset. And when we look at the LCSS, it is very rare. So in terms of LCSS, it is very rare. So let's recap this. So we discussed about the pulmonary manifestation. In case of the DCSS, diffuse type, there is a ILD, that is interstitial lung disease, it is more common. In case of the local LCSS, that is a limited cutaneous systemic sclerosis, it is involved with the PAH, that is a pulmonary artery hypertension, it is more common. Then when we look at the sclerodermal renal crisis, a sclerodermal renal crisis, in terms of the DCSS, it is less than 4 years of the disease onset, and in terms of the LSCS, so in terms of the LCSS, it is very rare. Next, we are going to move on to the calcinosis cutis. What is this? Calcinosis cutis. So this calcinosis cutis is nothing but it is LC, that is less common in terms of the DCSS, and it is more common in cases of the LCSS. It is more common in terms of the limited cutaneous systemic sclerosis. Now very important, we are going to see the autoantibodies. So under the autoantibodies, in the diffuse cutaneous systemic sclerosis, the example is anti-topoisomerase. Anti-topoisomerase, this is one, that is a SCL70, as well as there is anti-RNA. There is anti-RNA polymerase 3. Polymerase 3. This is all with respect to the diffuse cutaneous systemic sclerosis. In terms of the limited cutaneous systemic sclerosis, it includes the anti-centromere. Now let's recap. In case of the calcinosis cutis, the LC, what is less common? It is less common in case of the diffuse cutaneous systemic sclerosis, and is more common in case of the limited cutaneous systemic sclerosis. So talking about the autoantibodies, it includes the anti-topoisomerase 1, that is the SCL70, as well as the anti-RNA polymerase 3. So these two are present in terms of the diffuse cutaneous systemic sclerosis. Then when we look at the LCSS, so the limited cutaneous systemic sclerosis, it includes the anti-centromere. Now we'll be answering our questions. So the first question we asked was comment on the Raynaud's. Comment on the Raynaud's phenomenon. So in terms of the Raynaud's phenomenon, first we are going to look at the diffuse type. So the diffuse cutaneous systemic sclerosis. So here it is nothing but it is less severe. It is less severe and it has a short history. Then we also look at the limited cutaneous systemic sclerosis. So here it is more severe. It is more severe and it is commonly associated with the critical limb ischemia. The critical limb ischemia, and it has a long history. There is a long history. Now when we look at the autoantibodies, so what is this autoantibody? So in case of autoantibody, it includes, in case of diffuse, in case of diffuse, it includes the anti-topoisomerase 1, this is a SCL70, as well as the anti-RNA polymerase 3, anti-polymerase 3. Then when this is all in terms of the diffuse type, and in case of the limited cutaneous systemic sclerosis, in this case we have the anti-centromere. Now let's recap. So the questions we asked was comment on the Raynaud's phenomenon. So Raynaud's phenomenon in case of the diffuse cutaneous systemic sclerosis, there it is less severe and it has a short history. In terms of the limited type, it is more severe and associated with the critical limb ischemia. It is associated with the critical limb ischemia. Now we also look at the autoantibodies. So in terms of the autoantibodies, it includes, there is a anti-topoisomerase 1. So in terms of diffuse variety, it includes a anti-topoisomerase 1, this is the SCL70, as well as the anti-RNA polymerase 3. So when we look at the limited type, it includes the anti-centromere. So this was about comparing the diffuse cutaneous systemic sclerosis versus the limited cutaneous systemic sclerosis. So in terms, if you want to learn and grow daily, please do subscribe.